Welcome back. Welcome back. Your man Diamond K in here, of course. RadioOnFire.com, TheDiamondKShow.com. Hope everybody had a good weekend. So, man, it is not stopping. Of course, we knew this. Coronavirus, as of right now, has killed more than 300,000 people across this country. At the same time, the United States officials ship out the first of nearly 300 million doses of Pfizer's COVID-19 vaccine to distribution centers across all 50 states. As the country is grappling with the devastating death tolls, surges in the hospitalizations. Also, a historic inoculation effort is also underway. They're trying to get this thing under heel. Right now, the U.S. has reported at least 16 million coronavirus cases, the most in the world, according to data compiled by Johns Hopkins University. More than 300,000 people across the country dead. Man, so the FDA, Food and Drug Administration, on Friday granted emergency use authorization for the vaccine developed by Pfizer and BioNTech, based on data that showed it was 95% effective. That's what the data is showing. CDC Director Dr. Robert Redfield signed off on the vaccine late Saturday, allowing the inoculations to officially move forward in Americans 16 years and older. Because as we said, this is not reported to be safe for kids or people under 16 just yet. First doses go to healthcare workers, residents in long-term care facilities. They get it first, as they should. FDA is also releasing a data assessment this week for Moderna's vaccine. That's going to be reviewed. The company's request also for emergency use authorization. This is like, person's grade dying. We don't know what to do. Here, take this. It's not tried. It's not safe. We don't care. Let's try it. Emergency use only. If this is approved, Moderna's vaccine could be administered as early as December 21st to help the U.S. provide 20 million vaccinations in the month of December. 50 million by the end of January, 100 million by the end of February. That is their early projections. That's what they're on schedule to do. That's what they're trying to do. Interestingly, healthcare officials have said that 75 to 80% of the total U.S. population must get vaccinated in order to achieve this desired herd immunity, for a period where enough people are protected so the virus can be contained. Herd immunity is something that they have been talking about for months. It's like the Holy Grail, herd immunity. Now, surprisingly, I don't know why they're concerned about, or let me say it this way. I don't know why they are surprised that this is happening, but health officials are concerned about public doubt in the efficacy and the safety of the speedy vaccine rollout. You don't say. If you want people to trust your drug, your vaccine, doing it under something called Operation Warp Speed, which usually means fast, well, why would people trust that? The reason approval takes so long, generally speaking, is because you want to take time to make sure that it is safe. You want to know what side effects are, and that takes time. But this president calls that process slow, turtle. And he discredits the process of approval of finding out side effects of the vaccine. So, of course, many people are concerned. Of course, many people doubt the efficacy and the safety of this speedy vaccine, quick vaccine. One poll that I saw showed that only half Americans in the country say they want the shot, while a quarter aren't sure about it and another quarter say they won't get it. I'm in the quarter that won't get it. And even with this vaccine rollout, health researchers are forecasting that U.S. death could double and reach over 500,000 by April 1st, and are urging people to wear masks and limit gatherings to manage the spread of the virus. This is very important, especially if you're not trusting the vaccine. And let's keep in mind this. The vaccine distribution will only reduce the death toll by 9,000 by April 1st. Let me say that again. After all this hoopla, vaccine distribution is only going to reduce the death toll by 9,000 by April 1st. So they're targeting high-risk individuals. And they think that could further save 14,000 lives. Of course, these numbers are estimates. They don't know for sure. They knew so much they would have a cure for this. It's become harder and harder for hospitals to maintain staffing because many of their employees are getting sick with COVID-19 and forced to quarantine because of their exposure. So yes, something has to be done. But it seems to me so strange that the philosophy is never to find a cure. They don't use the word cure anymore. They want to find ways for you to live with it so they can continue to make money. Because a cure would just be an ender. Just end it, right? They don't want a cure. They just want to patch it up. I'm urging the public to do everything that they can do to help prevent the spread of this infection. Clearly, the Trump administration not very concerned with it. Half-hearted effort. If the public does not help during these next few months, it's going to be a horrible, long winter because there are a lot of people dying that don't have to die. Well, that's what's going on. U.S. death tolls over 300,000. Vaccines out. It's out. It's on the way to the people that need it the most right now. And we're going to see what happens with this. Later on tonight, I'm going to be talking about the final nail in the coffin of Trump's foolishness. That and much more tonight on the Diamond K Show, 7 p.m. radioonfire.com. Mainstream media often promotes misinformation. Radio on Fire provides Americans unapologetic, progressive news coverage and opinion. Our outlet challenges the establishment and provides a platform for people to demand positive change while speaking truth to power. So I'm going to say some things sometimes that mainstream outlets are not going to say. I'm going to tell you the truth. I'm not going to sit here and say I believe this vaccine, because I don't. I think it's too soon. You ever cook something in the oven, turn the flame up real high, cooks it on the outside, but the inside is still undone? So what happens when you cook something too fast, when you move too quickly? Did this vaccine come out too fast? We're going to see. Hopefully everything is fine. But if you look at the language on Pfizer's website, they're trying to make sure that they are covered. In Maryland, UMMS received the first doses of Pfizer's COVID-19 vaccine. University of Maryland Systems received it. Shipment arrived today, this morning. So downtown Baltimore, the University of Maryland Medical Center. Doctors there said that they're very excited to be part of this. This is a historic moment for our medical systems and our country as we continue to fight against this pandemic. It took a lot of effort to get to this point. Our system has been planning for this day for quite some time, the doctor said. So state officials are planning to distribute these vaccines in the coming days. Pfizer vaccine could go out as early as tonight, while the Moderna vaccine is expected to come next week. The distribution plan has been laid out by Governor Larry Hogan, and it's going to come in 4 stages. Phase 1A will include health care workers, long-term facility care staff, and first responders. Phase 1B will include people with higher risk and underlying conditions and adults in those kind of settings. Phase 2 will make the vaccine available to people in other critical essential infrastructure settings. Phase 3 will make the vaccine available to the general population. Once Maryland reaches phase 3, the vaccine will be given like a flu shot at a pharmacy, clinic, or a doctor's office. By the time we get to phase 3, we'll definitely have a good understanding. And let's say this, all of the vaccines are not created equal. All the vaccines are different. So one vaccine might work, the next one or may not, or, we kind of got to see what vaccine did you take. But I'm definitely skeptical of this first batch. That's that first batch. You don't want that first batch. And then on top of that, this first batch, you need 2 doses over the course of about 4 weeks. So you got to make sure that you got 2 doses in order for it to work. And we still don't even know how long it works. But this is an ongoing thing. This is still developing. We are at the early stages. And I'm very excited and hopeful for this. But the history of vaccines in this country with my people has not been something that is easily trusted. Not something that's easily trusted. Takes time. So there was also talk about who was getting this vaccine. So we talked about the healthcare workers and our seniors in long-term care facilities, right? But news of the authorization, which came after the UK reported their vaccine rollout, right? And we've seen video of that Pfizer BioNTech vaccine. Since then, the FDA's, done whatever they've done, whether it was at the urging of the president, which it was. So then there was reports that people in the White House were going to get it. And I don't see anything wrong with that. And Trump said that people working in the White House should receive the vaccine somewhat later in the program, unless specifically necessary. I have asked that this adjustment be made. I am not scheduled to take the vaccine, but look forward to doing so at the appropriate time. If that does not make you skeptical of this vaccine, I don't know what will. 6 months ago, he was talking about, we need these vaccines real fast. Now, he won't take it first. Isn't it very strange that he's not trying to take the vaccine? This is very strange. He was definitely put in a tough position. Let me know your thoughts in the comment section. Instagram, Facebook, Twitter, LinkedIn, TikTok, at The Diamond K Show, at Radio on Fire. Of course, I'll be back later on tonight, 7 p.m.